All right, let's jump right in. Today, we're tackling a massive question, one that's at the very heart of public health. How do you find the people who need help the most before they even know they need it?
I mean, think about it. In a city packed with millions of people, how do you find that one person? Everyone has their own unique story, their own health profile. It can feel like a totally impossible task. But what if? What if we had a new kind of magnet?
So here's our game plan for this explainer. First, we're going to look at that classic needle in a haystack problem. Then we'll introduce the solution, what we're calling the machine learning magnet. We'll peek under the hood at the data and methods, check out the real-world impact, and finally, we'll look to the future of prevention.
Okay, Section 1, a needle in a haystack. You know, this metaphor, it just perfectly captures a key challenge in modern public health. We are literally swimming in information, just drowning in data, and finding that one crucial signal in all that noise, it's incredibly difficult.
For decades, the methods we've used in public health were great for their time, but they just can't keep up anymore. They really struggle to process the sheer volume and complexity of the health data we have today, and that makes it really tough to spot risks early.
But this is where things get really exciting. Let's talk about the machine learning magnet. It's a powerful new tool for this very old problem. This is the technology that's finally going to help us find that needle in the haystack.
And the core idea here is something called risk scoring. Honestly, the best way to think about it is like a credit score, but for your health. It's a single number that a machine learning model comes up with to predict the chances of a future health issue. And it is an absolute game changer for figuring out who needs attention.
So you're probably asking, how on earth does a computer actually calculate that score? Well, let's look at the data and the methods, because like any good recipe, it all starts with the right ingredients and the right techniques.
So the ingredients for these models go way beyond just a basic medical chart. We're talking demographics, clinical records, insurance claims, and then it gets even broader, pulling in environmental factors like air quality and social determinants like a person's income or housing situation. All of this data together creates a much more complete picture of a person's life and their actual risks. And then you have the recipes, the machine learning methods that analyze all that data. You've got things like clustering, which groups similar patients together to find hidden patterns. There's supervised learning, where you train a model on past data to predict a specific outcome, like a heart attack. Anomaly detection is all about finding the unusual outliers that might otherwise get missed. And ensemble methods? That's a clever trick, where you combine multiple models to make the final prediction even more accurate.
Okay, so that's the tech. But now for the payoff, making our healthcare smarter, faster, and healthier. This is all about the real-world impact. Why should you and I care about this?
This slide really just says it all. Traditional methods were slower, they couldn't handle nearly as much complex data, and they were often less accurate. Machine learning completely flips the script. It's faster, it thrives on complexity, and it delivers a much more accurate prediction. It's a night and day difference.
So where is this actually being used? Well, one of the biggest applications is in predicting risk for chronic diseases. Think about stuff like diabetes or heart disease. For a patient, catching that risk months or even years earlier, that can completely change their outcome. It makes all the difference in the world.
And it goes way beyond physical health. These models are also being used to detect these really subtle patterns that are related to mental health and substance use disorders. These are incredibly complex areas where traditional methods often fall short, but machine learning can pick up on warning signs that might otherwise go completely unnoticed.
And this is so crucial. It can also identify risks that's tied to those social factors we talked about earlier. Things like unstable housing or not having good access to care can have a massive impact on health. This technology helps connect the dots between a person's real-life circumstances and their potential health outcomes.
So when you put it all together, the payoff is just huge. We get earlier detection of people who are at risk, and we get more accurate predictions. This allows for a much smarter allocation of our limited healthcare resources, and it helps policymakers create targeted programs that actually work.
All of this leads us right to our final section, looking at the future of prevention. Because this isn't just about what technology can do today, it's about fundamentally changing how we even think about health.
And I think this quote just sums it up perfectly. The goal is to move from simply reacting to sickness after it appears to proactively preserving health before a problem even starts. It's a massive shift from just treatment to true prevention.
And that leaves us with a really profound question to think about. If we have the tools to predict who is most at risk, what is our responsibility? as individuals and as a society, to act on that knowledge?
That's a huge question we'll all have to grapple with as this technology evolves. If this explainer gave you something to think about, please like and subscribe to see more breakdowns just like this one.
We'd love to hear your thoughts down in the comments. And hey, if you prefer to listen on the go, you can also find the audio version on Apple Podcasts. The link is right there in the description.
Seriously, let us know your answer to that final question. And tell us what other complex topic you want us to explain next. Thanks for watching.